Welcome to the show. I'm Kathy Ireland. Substance abuse is a growing problem in the United States, where some 53 million people, over 19% of the population, have used illegal drugs or misused prescription medicine sometime in the last year. Dr. Theodore Bender of the BeWell Network joins us today to talk about the risk factors for addiction, why the COVID pandemic has made it harder to get help, and how his facility's multidisciplinary approach to recovery is helping people from all walks of life embrace a brighter, happier, and healthier future. Welcome, Dr. Bender.
Thank you so much for having me.
Well, Dr. Bender, how big of a problem is addiction in the United States?
It is at its worst point in our nation's history right now. And a lot of that gets overshadowed by the COVID situation. But what we found in 2020 was that we have reached the peak of overdose death in the United States, hitting 90,000 overdose deaths in 2020. Comparatively to the year before, we were around 70,000. So we saw nearly a 30% increase in overdose deaths during the worst parts of COVID.
Dr. Bender, what is the BeWell Network and how is it helping individuals with addictions to take on all these challenges?
BeWell Network is a group of treatment facilities here in Southern California that aspires to be one of the premier treatment centers in the country. We treat the disease of addiction and co-occurring mental health disorders using evidence-based practice and the most up-to-date scientific research and tactics. Now, a lot of places say that they do that, but it's important to really delineate what that means. So if we're saying evidence-based care, scientifically supported treatments, what does that mean to the average person? Well, a lot of companies say that they're doing that, but there is specific treatments for specific disorders and mental health disorders that have been shown through science and research to be most effective for that disorder. So we specifically tailor the treatments, the groups, the individualized treatment to the specific disorder of the patient. But we're taking that a step further. It's not good enough for us to be status quo. I also have a heavy background in data analysis and statistical analysis. And we have partnered up with another company that does data informatics. And they have a proprietary predictive algorithm that they can use the data of the patients to predict outcomes. So we can now see ahead of time whether someone may be at risk for an immediate relapse, imminent suicide risk, or risk of early departure from treatment, all giving us an edge to help to prevent those outcomes and help the patient turn it around faster than most facilities.
Good Heart changed my life in the sense that it gave me a very safe place where I was able to dig deep and find the underlying issues that I've needed to deal with my substance abuse problems. My biggest aha moment came when I did an exercise that my therapist asked for, which was very emotional, very gut-wrenching, but definitely something that I needed to do in order to achieve, getting to that point where I knew I was going to be okay.
In the beginning, Good Heart changed my life by giving me a safe place to kind of decompress from my life and be able to really open up, to be able to do the work in therapy that I needed to do to get to where I am today. I felt like an actual person and not just a statistic or a diagnostic code.
What separates Sheer from most facilities is we don't turn down difficult clients or walk away from those who seem too difficult to benefit from care in a treatment facility. We have a lot of people who have gone through other facilities, maybe 7, 8, 12, 15 different treatment facilities, but we bring them. And to watch them grow, go through their trials, and know that we're there for them when they're at those high-risk impulsive states of like wanting to leave, that's what separates us, is the ability to keep clients who don't normally last at regular treatment facility.
And is the goal total recovery?
That's a great question too. And yes, the goal is recovery, but the definition of recovery is changing. It used to be, and in a lot of circles still is, that abstinence only, total sobriety is the only successful outcome. Unfortunately, that doesn't happen very often. Now, I know plenty of people that have 10 years, 20 years, 30 years of recovery, and they're amazing people, and a lot of them give back to people who are struggling. But harm reduction is kind of the word that's used more these days, and that may be a reduction of use, or alcohol use, or drug use. It may mean getting on other medications that help them to stay off the more dangerous drugs like fentanyl or heroin. It's also about education, teaching people and patients and individuals, how to live a sober lifestyle. It goes beyond that. You're not just treating the patient that's in recovery or in your treatment facility, you're also working with the families, the home environment. This disease is a family system illness. It's not often just the one person. Many people around that person are also suffering from either mental health disorders or the stress and anxieties that come with living with someone who's suffering from a substance use disorder. So recovery, yes, is the goal, but that's not the only goal anymore.
And Dr. Bender, are your facilities mostly inpatient treatment?
We do have inpatient facilities. In the treatment industry, it's known as detox and residential treatment, where we use a medical model to detox the patients. We do not want them to suffer through detox, and going through it cold turkey is suffering. So we use medications to ease that process. But once we get them through that detox and residential phase of treatment, long-term treatment is a critically important piece of all of this. And we do have outpatient services as well across Santa Barbara, Los Angeles, and Orange County, where patients can stay for even longer periods of time, for 60 or even 90 days.
Are there certain accreditations or memberships that potential patients researching addiction facilities like BeWell should look for?
Yes, for patients and for family members or whoever's looking for the treatment facilities, you want to make sure that they're Joint Commission accredited. The Joint Commission accredits over 22,000 healthcare facilities, and they're known globally as the leader in accreditation. And they're very rigorous, and all of our facilities are Gold Seal approved by Joint Commission.
Dr. Bender, it takes a lot of dedication and passion to guide patients on the complex path to recovery. What can you tell us about your team?
It's the pride of what I do. I've worked in several facilities around the country, and every time I go to a new treatment company, the one thing that I noticed immediately is that camaraderie that we all have. We're different individuals, we come from very different backgrounds, but you don't work in this industry, especially long-term, unless you have a deep compassion and empathy for those who are suffering. And that's something I can always bond with my people and my teams almost immediately. If you think about it for a moment, it takes an incredible person to willingly enter into the pain of a complete stranger, and to do that again and again and again, day after day, for years. And my team is filled with people like that, which makes it just an incredible pleasure to go to work every day.
We have a clinical team, which is the tip of our spear here, who does all the clinical needs with our clients, the therapeutic nature. We have a nursing team, which consists of RN and LVNs, and then we have our operations teams, which are techs. The techs assist the clients with all the basic needs that they need throughout the course of a day. They do groups throughout the course of the day, and any other one-on-one sessions that clients need to be with when the clinicians are with other clients here or doing our family sessions, which takes them away from that. So in total, we are a complete team that works in its totality, and we come together to give the clients exactly what they need, and that's great treatment here at BeWell.
Whether it's just coming in with a smile or coming in with a joke or coming in creating that safe space for someone to talk, that is changing someone's life. Whether it just feels like a general conversation or whether it's really digging deep into what someone is dealing with, that is just something that for me is very rewarding.
We have an incredible team at Sure Recovery, from our team of directors to therapists and case managers. We have an incredible support staff, and they spend the majority of the time with the clients. And I would say one of our mottos is that we take client care seriously, but we don't take ourselves too seriously. So we create a culture and an atmosphere of loving each other, supporting each other, and loving the clients.
Dr. Bender, what advice would you give someone watching our program right now who might be struggling with addiction or mental illness, or who has a loved one they're concerned about?
The short answer is that help is available. It can feel extremely hopeless and that like nothing will ever change, but that's not the case. The disease of addiction is a treatable illness. Mental health disorders are treatable. Signs and symptoms of this illness, or times where you might want to consider picking up the phone, the key question is this: are these symptoms causing difficulty in your daily life? Are you not fulfilling the responsibilities or the roles that you have in your life? Are you having financial problems, physical health problems, worsening mental health problems, thoughts of suicide or planning for suicide? If any of these things are happening, pick up the phone, reach out for help. BeWell Recovery is here for you 24/7, and we're always available and ready to go.
That is a wonderful and powerful message, and I hope anyone who needs help is able to hear your message and reach out to take that next step to recovery. And speaking of next steps, what's on the horizon for BeWell?
I'm glad you asked that question because I'm very excited about what we are working towards. We mentioned the evidence-based practice model, which is the standard in this industry, and anyone who's not doing that should be doing that. But taking that to the next step, we have to be looking on the forefront of the horizon on addiction treatment. Because let's face it, we have very good treatment, but addiction and overdose death is getting worse and worse every single year. So we need to do better. There are new treatments that are coming on the horizon that may make major impacts on this disease. There may be pills someday that completely remove the ability for you to experience a high or euphoria from these medications, from these drugs or drugs of abuse. Where I think the real magic is, again, is data. I think that one of the greatest resources that many treatment companies have in hospital systems and healthcare systems is their data. And using their data to empower their treatment abilities and business decisions is crucial. We're already talking about how we can predict now with great accuracy who is going to relapse, who may be at risk for leaving treatment early, future suicide attempts. It's all getting stronger, but I think we're just at the tip of the iceberg. And we're investing very heavily in data analytics, predictive algorithms, and also we're going to be very active in the research department for treating this disease going forward.
Great. Dr. Bender, what is most meaningful to you about this work?
You know, I've been doing this a long time, and for every heartbreaking story, I can tell you 10 amazing stories of life turnarounds. I've said this to my whole career and to anyone who's been listening to me the last 10 years or anyone that I've worked with. If I spend my entire career treating this disease and retire at the age of 65 or 70 or whatever, and if one life was saved, then my entire career was worth it. And I know for sure already through many of these anecdotal experiences that we have well surpassed that number of only one.
Well, congratulations to you. Thank you for the amazing work that you're doing, and thank you for joining us today.
Thank you.
Thank you. And thank you for watching. I'm Kathy Ireland.